Welcome to today's Facebook Live. I am Susan Mills, a Media Public Information Officer for Oregon Health Authority. With us today from the Oregon Health Authority are Public Health Director Rachael Banks and Senior Health Advisor Dr. Ann Thomas. They will answer your questions about COVID-19 booster doses and third doses. Please put your questions in the Facebook comments section and we will pick them up from there. Also, just a reminder that today's discussion and question and answer period are really for the public. We ask that any reporters who may be here wait to ask questions at our next press conference or send their questions to our PIO team. Thank you. Let's begin our discussion with some words from Director Banks.
Thank you, Susan, and hello, everybody. Thank you for joining us. I'm going to start with an overview of where we are with COVID-19. So the surge in COVID-19 infections and the hospitalizations that we saw a few weeks ago have leveled off. As of yesterday, our 7-day average of daily cases was 1,498. The same average for reference on September 1st was 2,200. We're seeing a similar drop in the percentage of positive tests from 12% to 9.8% over that same period. And for our most recent COVID-19 weekly report for the week ending September 26th, we reported 11,410 new cases of COVID-19 infection, which is a 2.1% decrease from the previous week, despite a 13% increase in testing. Newly reported cases have now fallen for 4 consecutive weeks, and new COVID hospitalizations and COVID-19 related deaths are also beginning to plateau and even decline. This recent data is clearly encouraging, but the Delta variant is still a very real threat, especially for our too often overlooked communities. These decreases that I talked about have not been experienced the same across all communities, which means we are still seeing unfair and troubling COVID-19 inequities. The upcoming holidays bring the potential for another increase in cases, along with the colder weather. And data suggests as the pandemic continues, waning immunity may be a factor in hospitalizations and deaths among the vaccinated. According to our latest weekly breakthrough case report, of the 11,567 COVID-19 cases reported through September 19th through September 25th, 79.2% occurred in people who were unvaccinated. There were 2,401 breakthrough cases, accounting for 20.8% of all cases. This means the rate of COVID-19 in unvaccinated people is approximately 4 times higher than in vaccinated people. But the proportion of vaccine breakthrough cases who died with COVID-19 has increased over time. And these deaths are a result of more disease in the community caused by the Delta variant and the small decrease in vaccine effectiveness found among particularly the elderly and particularly among older residents in long-term care facilities who were vaccinated earlier in the vaccine rollout. Both the recommendations from the Centers for Disease Control, or CDC, for a booster dose for older age groups and the third dose for immunocompromised people are important to protect against inadequate or waning immunity. It's important to understand, and we get a lot of questions about the difference between a third dose and a booster dose. A third dose is for people who are immunocompromised and may not have built up an adequate protective immunity with their first series of mRNA, through either Pfizer or Moderna vaccines. You will note that only the emergency use authorizations for Moderna and Pfizer COVID-19 vaccines authorize third doses for the immunocompromised. Currently, there is no third dose or even a second dose authorized for the Johnson & Johnson vaccine. Immunocompromised people can receive their third dose at least 28 days after receiving their second dose. If you think you may be eligible for a third dose and are immunocompromised, you should discuss this with your doctor, your healthcare provider, or clinic. A booster dose is strongly recommended for those people whose immunity may be fading 6 months after completing their second Pfizer vaccination and are in one of these groups. So once again, 6 months after your Pfizer dose for these groups: people who are age 65 and older, people ages 50 to 64 with underlying medical conditions. And lastly, while the risk of waning immunity is much lower for people age under 50, people age 18 to 64 who either have underlying health conditions or who are at risk of increased exposure or transmission because of where they work, where they live, also have the option of receiving a booster dose if they would like one. This last group is very large. It includes people who have been working throughout the pandemic to care for vulnerable populations and keep our society functioning. This includes healthcare workers and all patient-facing healthcare staff, not just medical workers. That includes food service and housekeeping staff at hospitals, workers who treat high-risk patients in outpatient substance use treatment programs, those who provide non-emergency medical transportation or work in hospices, first responders such as firefighters and police, congregate care staff such as caregivers and staff in long-term care facilities and group homes, those who work in educational settings such as teachers, support staff, and daycare workers, food and agricultural workers, those who work in manufacturing, corrections workers, the United States Postal Service workers, our public transit workers, grocery store workers, and people with intellectual and developmental disabilities and those who care for them. In addition, the Western States Work Group recommends that people at a higher risk because of long-standing health and social inequities should also get a booster dose. This can be due to social determinants of health, such as where you live, access to safe housing, or transportation issues. Some examples of this may be older people who take care of younger children or those living in multi-generational homes. Again, right now, the booster dose is approved for those who received the Pfizer vaccine 6 months ago or more and meet the eligibility requirements I just described. Currently, there is no booster dose yet approved for those who previously received the Moderna or the Johnson & Johnson vaccines. Both the booster and the third dose will help protect those at greater risk of developing severe COVID-19. But all COVID-19 vaccines still provide very high protection against severe illness, including hospitalization and death. Shout out to the more than 2.7 million Oregonians who have received at least one dose of the vaccine, and more than 2.5 million are now fully vaccinated in Oregon. Thank you to everyone who's taken the time and effort to get vaccinated. It's making a huge difference in this pandemic. Now I'll turn it over to Dr. Thomas, who will address some of the questions we've heard about the third dose and booster dose recommendations.
Thank you, Director Banks. We know people are concerned about whether they can get their third dose or their booster dose. The supply of the Pfizer vaccine in Oregon is still very high, with more than 400,000 Pfizer doses available across the state. If you or a loved one need your first COVID vaccine series for any of the COVID-19 vaccines, if you need the Pfizer booster dose for older age groups, or the Pfizer or Moderna third dose for immunocompromised individuals, please get that as soon as you can. Vaccine clinics should be able to provide any dose that you require, whether as part of the initial series, a booster dose, or a third dose. And you can always visit getvaccinated.oregon.gov to find a vaccine clinic near you. We know there have been many questions about the third dose and the booster recommendations, and we look forward to answering those. We understand that this is a confusing topic and hope to clear up some of the common questions. I'm going to start off now with some that have already come in. What if you are both high risk and immunocompromised? If you're in a high risk group, you're immunocompromised, and you've completed your Pfizer vaccine series, you only need one more shot. So if you were fully vaccinated, or if you've received the Moderna, if you were fully vaccinated with either Pfizer or Moderna, you should get that third dose of the same vaccine at least 28 days after your second dose. Unfortunately, if you were fully vaccinated with Johnson & Johnson, there aren't any recommendations for additional doses at this time. The next question is, what if you are in a high-risk group but not immunocompromised, and it hasn't been at least 6 months since completing your Pfizer vaccine. If 6 months haven't gone by, you are still very well protected. Please wait 6 months to get the Pfizer dose so that the first people to complete their Pfizer vaccination series back in December of 2020 and January of this year, such as people in long-term care facilities and other adults over the age of 65, can get their booster doses now. And then when will we learn more about booster doses for the Moderna and Johnson & Johnson vaccines? More data is needed before the federal government can make recommendations about booster doses and third doses for all 3 vaccines. We hope to learn more in the next few months. But please remember, most of the hospitalizations and deaths from COVID-19 in this latest surge have occurred in people who are not vaccinated. If you are in a high-risk group and are fully vaccinated using the Moderna or Johnson & Johnson vaccine, you are still very well protected from COVID-19. Now, if you are immunocompromised and receive the Johnson & Johnson vaccine, please be patient. At this time, the CDC does not have enough safety and effectiveness data to recommend an additional dose of vaccine for immunocompromised individuals. We want to find out more about the safety and effectiveness of a booster dose before we start recommending it to people living in Oregon. In the meantime, we need everyone to do their part to keep practicing the good habits that will help keep our families, our neighbors, and ourselves protected. That includes wearing a mask, physically distancing, washing your hands, and staying home if you're sick. We encourage all those living in Oregon who can get vaccinated against COVID-19 to do so today. If you're eligible for a booster dose or a third dose, be sure to get one soon. If someone you know is undecided about getting vaccinated or getting a third booster dose, please share this information with them. And with that, we can take more of your questions.
Thank you, Director Banks and Dr. Thomas. We will now take questions. Again, we ask that you put them in the Facebook comment section and that your questions be limited to the topic of booster and third doses. We will address other COVID-19 questions in future Facebook Live events. Our first question is from Pam. And it's for you, Dr. Banks, or Director Banks, excuse me. This is the first I've heard about needing a third dose of Moderna, 28 days. It's been 6 months since most of us have gotten Moderna. What's going on?
Thanks, Pam, for your question. Appreciate it. So as we've talked about and understanding there's been confusion between a third dose and a booster dose. A third dose, which could be for Moderna or Pfizer, would be for those who are immunocompromised. So it could be that people haven't heard about a third dose because they are not immunocompromised or their provider doesn't feel that they need that additional third dose. If you do feel like you are immunocompromised, please contact your provider, your doctor, or we can help make recommendations for federally qualified health centers or other community health centers if you do not have a provider, to have that conversation about whether you should get that third dose. And if you are in that immunocompromised position, then you would be eligible for a third dose if you received either Moderna or Pfizer at least 28 days after your last dose. To specify the booster doses, which are now 6 months or out, those are particularly for Pfizer.
Thank you, Director Banks. Dr. Thomas, the next question is, I believe, for you, and it's from Tyrene. Will the boosters contain updated vaccine? If not, why would you get a booster when the new strains are reportedly immune to the vaccines?
At this point, there won't be any change in the vaccines. They'll be the same formulation. However, it's a bit of a myth that the vaccine is not effective against the Delta strain. The reason that we're having this resurgence is that the Delta strain is more transmissible. In other words, it's easier to infect other people and to spread it around more easily. And in fact, most of the cases that have occurred in Oregon, particularly when you look at the hospitalizations and deaths in this recent surge, have occurred in unvaccinated people. And as scientists have been addressing this question of a waning immunity, I've seen several presentations and looked at lots of data. And it really seems that the problem is that the vaccine is waning over time, or people are losing some of their immunity over 6 months, but that the vaccine is still working against the Delta variant. So the issue is that older folks are developing, are losing some of their antibodies. They can't mount as good of an immune response, but a booster should still cover the Delta variant.
Terrific, thank you. Our next question is from Marcia. We're 66, have an autoimmune disorder, and got the Johnson & Johnson vaccine. Will Johnson & Johnson be available for boosters?
It's very frustrating because at this point, I know a lot of people in that boat and they're wondering what to do about the Johnson & Johnson. Unfortunately, we really can't recommend that people booster unless we really have data on the effectiveness and the safety of a booster for the Johnson & Johnson. Now, fortunately, Johnson & Johnson has made an application to the FDA to get an authorization to give a booster dose. But that's going to take probably a few more months because the FDA committee reviews it, and then the CDC's advisory committee on immunization practices reviews it. So it's probably going to be later this fall before we know anything for sure.
And Andrew asks, it's been 5 months since my second dose, but I got a breakthrough case. I fall in the category of needing a third shot. Should I wait? And if so, how long?
Okay, at this point, there hasn't been really study of people who get breakthrough infections and whether they need a shot. Initially, when unvaccinated people got sick, we know that sometimes you can get reinfected, so we recommended giving people, that people go ahead and get a COVID-19 vaccine. And at this point, if you're fully vaccinated and you're a breakthrough case, you're probably getting a bit of a boost in your immunity just from having been sick with COVID-19. So you're probably protected. We don't know for sure, and that will just take time to sort out. At this time, CDC is not recommending a booster for people with breakthrough infections. So we'll just have to wait and see what happens over the next year as we track people who have been in this situation.
Thank you. And Randy asks, I'm 71 and have asthma. When can I get my Moderna booster?
Okay, so unfortunately, just the booster for anyone over 65 is at this point limited to people who have gotten Pfizer. The only people who would be able to get a Moderna third dose would be people with immunocompromising conditions, and asthma doesn't really count. So at this point, unfortunately, we're going to have to ask you to wait until we know more about Moderna's application for a booster dose. Again, that's something that's going to be presented to the FDA in a matter of weeks. So I think we'll have an answer on that in later this fall.
And thank you. The next question comes from Chalk Yi. I was vaccinated with Moderna in January and February. My doctor just had me get the third dose. How long before it is effective?
Well, just with pretty much with any of these vaccines, whether it's your first dose, your second dose, kind of the immunity that you're going to get from that shot takes about 2 weeks.
Great, thank you. Director Banks, Judy asks, how does the third dose differ from the booster dose?
Thanks, Judy. Great question. So the third dose is specifically for those who are immunocompromised and therefore may not have gotten the protection or that immune response from the first 2 doses. The third doses are either for Moderna or Pfizer for those immunocompromised, obviously in consultation with your provider or your doctor, and they occur 28 days or can occur 28 days after the second shot. The boosters are for those after, 6 months, at least 6 months out, who may have waning immunity. At this point, as Dr. Thomas mentioned, we have data and science in terms of efficacy and safety for the Pfizer vaccine at this point. So those who have received a first and second dose of Pfizer and are at least 6 months out and meet those eligibility criteria that we talked about before, whether that's because they're over 65, whether that's because they're 18 to 64 with underlying health conditions, or whether it's because they're working in a high-risk work setting. So that is the difference. And I'll just pause and see if Dr. Thomas has anything that you'd like to add.
No, I think you've covered all the points. I think the main thing is that if people are wondering, do I wait a month? Do I wait 6 months? What am I? If you're immunocompromised, after your second dose, you don't really develop enough antibodies. So we want you to get that third dose in 28 days so that you'll be protected fairly soon. We wouldn't want you to wait the full 6 months. But if you're if you're deciding between, for just someone who doesn't have immunocompromise, you want to wait 6 months because you're protected now. And so you can afford to wait that 6 months, and that's kind of when you'll need that boost.
Thank you. Linda asks, are additional doses going to be available in Reedsport, Oregon?
At this point, anywhere that Pfizer vaccine is available, I mean, it can be given for a first dose, a third dose, a booster dose. So I think the key thing is to find if there's Pfizer in your community, and you can go to getvaccinated.oregon.gov or check with your provider or check with local pharmacies.
Okay. Ali is asking, do teachers count as high risk, as being in high risk settings?
Thanks, Sally. Yes, teachers do count as being in those high risk settings. And so if they got a Pfizer first and second dose and it's been at least 6 months, would be eligible for a booster. I'd like to point out that in addition to teachers, this includes those who are working in the cafeteria and those who are supporting children in after school programs, those who are working in daycare settings as well. So teachers and those working in educational settings with our kiddos are all eligible.
Now, Judy, who originally asked about the difference between the third dose and the booster dose, has a follow-up question. She asks, is the solution in the syringe the same for the third dose and the booster dose?
Yes, it is.
Okay, great. Thank you. And Alred asks, I have late onset type 1 diabetes. Can I get a third Moderna dose?
Okay, at this point, a third Moderna dose is only recommended for people who are immunocompromised. Now, certainly we know that diabetes is a risk factor for developing complications of COVID, but you're not immunocompromised enough that you would really benefit from getting that third dose. So at this point, however, you would be recommended to get a booster dose. So at this point, you will unfortunately need to wait until we know about, the FDA and CDC approve of Moderna as a booster dose. But hopefully we'll have that in the next month or two.
Actually, interesting, that was a question from Katie. Do we have an update on when Moderna dose will be approved, Moderna booster will be approved?
The FDA hearings are scheduled pretty soon, really in the next 2 weeks. After that, the CDC's advisory committee they generally try and meet pretty quickly afterwards, like in the following week. And then here in Oregon, the last time literally we met the same day as the ACIP, like we met that night. It's the Western State Scientific Review Committee meets. And then after we make our recommendation, Governor Brown decides, again, with help from senior health advisors, about whether we should accept that. So I know it's frustrating because it seems like a long process, but we really care about getting things right and making sure it's safe before we recommend something to thousands of people. But I think we're really on target to have something. Let's see if we can say we can. I don't want to make promises, but I'd certainly like to get it before the holidays.
Okay, thank you. Our next question comes from Uzo. Do you see value in recommending periodic antibody tests, the COVID-2 IgG, for clear evidence of degree of immunity versus calendar timeline alone?
At this point, it's, it's funny because you hear a lot of researchers like looking at, the antibody response, and, in the presentation, some of the data that was presented to the FDA and the CDC, the vaccine manufacturers will look at, people's antibody levels following the vaccine to see if they're rising after people get a dose. And that's a good way to say, yes, they're responding. The other thing we look at is, real life over the next few months. Are the people that vaccinated, less likely to get disease? And that's how we get those measures of what we call the vaccine effectiveness. So to get to your question of the antibodies, it's really not very well defined yet about what is enough to really protect me. I mean, we know someone right after they've gotten their dose and that level goes up, we know that that's a good sign that we're protected. But what we don't know is kind of, well, what's the lowest level at which I would be protected? So if we don't know that, we don't recommend getting unnecessary tests.
Okay. And it looks like we have one last question. This is from Brad, and he's asking, is this a 6-month boost, an every 6-month booster shot?
Yeah, that's a great question and one that we would love to know about. Now, certainly with many other vaccines, only 2 or 3, they might require more than dose. They might require 2 or 3, but then they're very effective. Like hepatitis B, you get a dose 1 month later and then again at 6 months, and then you are protected for life. And I listened to the FDA hearings, and there are many vaccine and infectious disease experts who thought that this probably, certainly raised the expectation that perhaps this could be enough. The final answer, though, is we won't know until people have gotten, a booster 6 months later and, follow them for the next year or two. So it's very frustrating, and I wish I knew. But I think there's a hope. I think we can certainly hope that the third dose will be the charm.
Thank you. That was our final question. I want to thank our guests, Director Rachael Banks and Dr. Ann Thomas, for helping us better understand this complicated topic. We invite you to follow us on Facebook and Twitter and to sign up for the OHA newsletter at healthoregon.org/coronavirus. Thanks to everyone for participating. Have a great day and stay safe.